Hi, I'm Nancy Houston Miller, and I am a board member of the Pacific Stroke Association, which is a nonprofit organization whose mission is really to educate the public about stroke, stroke prevention, and stroke warning signs. And I'm pleased to be bringing this education series to you today. First of all, it's important to recognize that stroke is a medical emergency, that if you or someone is having a stroke, you need to call 911 and get to the emergency room. And we will explain what stroke is and how to recognize a stroke in the first part of this presentation. Second thing is that stroke is really treatable. There is a very short window of opportunity for stroke treatment of about 3 hours since the onset of symptoms. And time is brain. And we'll talk about current treatments for stroke in the second part of the presentation. And finally, it is important to note that stroke is really preventable. Scientists recognize that the risks of reducing the risks of stroke, and by using currently available treatments and therapies, that we could prevent about 80% of all strokes. So we will talk at the end of the presentation about risk factors and prevention. So what do we know about stroke in terms of being a medical emergency? Well, stroke is the leading cause of adult disability nationwide. And about 70% of strokes are associated with high blood pressure. A stroke occurs about every 45 seconds in the United States, and about 700,000 strokes occur each year, with about 500,000 of these being first attacks and 200,000 being recurrent attacks. Each year as well, about 46,000 more women than men have a stroke. And due to high blood pressure at an early age, Blacks have twice the risk as whites in terms of developing a stroke. In terms of looking at stroke as a medical emergency, stroke is really a brain attack, which actually causes damage to the brain initiated by either interruption of blood flow to the brain, most often through a clot, and it certainly is a disease of the vascular system. A stroke occurs when the blood supply to part of the brain is suddenly interrupted, or when a blood vessel in the brain bursts, spilling blood into the spaces surrounding the brain cells. In the same way that a person suffers loss of blood flow to the heart, which is known as a heart attack, a person with a loss of blood flow to the brain or sudden bleeding in the brain can be said to have had a brain attack. Unfortunately, brain cells die very quickly because they don't receive enough oxygen and nutrients from the blood when the brain has been damaged. And when the brain lacks oxygen, this is known as ischemia. When brain cells die, this is known as infarction. The same is true if you have a heart attack. What do we know about the types of strokes that people can have? Well, there are two types, either a hemorrhagic stroke or an ischemic stroke. An ischemic stroke is actually most common and is caused by blockage of a blood vessel supplying the brain, essentially through a clot. A hemorrhagic stroke occurs in about 12% of cases due to bleeding that occurs either within the brain or around the outside of the brain. So a sudden rupture of blood vessels, which is known as a hemorrhagic stroke, and there is decreased blood flow, there is often swelling, there is irritation, and there is death and injury to the brain cells. Essentially what happens is when an artery in the brain bursts, blood either spews into the outer surrounding tissue and upsets not only the blood supply, but the chemical balance of neurons that are required for brain function. This again is called a hemorrhagic stroke, and it occurs in about 12% of all individuals. Now, this is an example given to us by one of the neurologists looking at what happens with a stroke that is caused by a ruptured artery. When an artery in the brain bursts, then blood spews into the surrounding tissue and upsets not only the blood supply, but the chemical balance, as I mentioned, of neurons. This is called a hemorrhagic stroke once again. And as you see on this particular slide, on the right-hand side, the area of dead tissue and clot is located on the very far right. Hemorrhage can also occur as a result of what is known as a bleeding aneurysm, which is also a weak or thin spot on the artery wall. What happens over time is that these spots stretch or they balloon out under arterial pressure. And the thin walls of these ballooning aneurysms can then rupture and spill blood into the space surrounding the blood cells. You can often find many aneurysms that are very, very small within the brain. What happens is they become larger, as you see on the left-hand side of this slide, is a fairly large aneurysm that could potentially burst. So what do we know about what is known as a transient ischemic attack? Well, about 15% of all massive strokes are preceded by one or more TIAs. 5% of these will occur within 2 days, and 10% within 90 days. A TIA, it's most important to recognize that a TIA is really a warning sign. You can't ignore it. And if you're really looking at trying to diagnose and treat the cause of a TIA to prevent a massive stroke, you must react to the symptoms that you encounter if you have a TIA. A TIA is really a temporary clot causing a temporary decrease in blood flow and oxygen to the brain. You can have the same type of symptoms that you have with a stroke, but normally those symptoms will resolve within minutes to less than 1 hour in terms of your overall condition. So let's talk about what happens in terms of the consequences of a stroke, and what are the symptoms and for each type of stroke, and what is most affected by a stroke in terms of where it occurs within the body. So if a stroke occurs on the left side of the brain, then people are going to experience weakness and paralysis or altered sensation on the right side of the body. People with a stroke that occurs on the left side also have aphasia or difficulty in their ability to speak and write. They have problems with numerical recognition and calculations, and they often have difficulty with emotional reactions such as anxiety and depression. For those individuals who have a stroke on the right side of the brain, they have weakness, paralysis, or altered sensation on the left side of the body, and they may have difficulty with spatial and perceptual awareness, problems with expressing their emotions or recognizing the emotions of others, and they may have very impulsive reactions. Finally, if people have difficulty with a stroke that occurs in the brain stem and the backside of the brain, they will have difficulty with double vision, with swallowing, and they may have weakness on both sides of the body. Now, we know that stroke is preventable, and therefore we need to watch for risk factors. But what are those risk factors? We know that there are things that are uncontrollable in our lives that will not help us in terms of trying to prevent a stroke. We know, for example, that after the age of 55, the risk of stroke doubles in individuals. And for every decade after the age of 55, not only does stroke double, but 2/3 of all strokes will occur in people over the age of 65. Gender also plays an important role. Men have a higher risk for stroke, but more women die from stroke. The stroke risk for men is 1.25 times more than for women. Stroke also runs in families, and several factors contribute to familial stroke risk, especially risk factors such as diabetes and hypertension. Finally, the risk for stroke varies among different ethnic and racial groups. As I've already mentioned, the incidence of stroke among African Americans is almost double that of white Americans, and twice as many African Americans who have a stroke die from the event compared to white Americans. African Americans between the ages of 45 and 55 have 4 times the stroke risk of death, and after 55, the stroke mortality rate for whites is often equal to that of African Americans. In addition to that, other groups are also at risk. For example, Hispanics and Native Americans have a stroke incidence and mortality rate that are similar to those of white Americans, and in Asian Americans, stroke incident and mortality rates are also similar to those to white Americans. So it suggests that environment and lifestyle factors can play a very strong role in stroke risk. We also know that stroke is very preventable. As I mentioned, scientists indicate that about 80% of all strokes could be prevented. Our controllable risk factors include everything from stopping smoking to maintaining a normal blood pressure with a target optimal blood pressure being less than 120/80, to maintaining healthy blood cholesterol levels, preventing or treating diabetes, and treating atrial fibrillation. These risk factors are not only very familiar to many of you because they're risk factors similar to heart disease, but the difference in stroke prevention is being able to treat atrial fibrillation. So what about smoking? Well, cigarette smoking is the most powerful modifiable risk factor. Smoking causes increased blood pressure, increased clotting of blood, and damage to blood vessel walls. It not only causes damage to the vessel walls, but it reduces the amount of oxygen in the blood, causing the heart to have to work harder and allowing blood clots to form more easily. And finally, it increases the amount of plaque within arteries, which then can block the blood flow to the brain, often causing what is known as an ischemic stroke. Unfortunately, women who smoke and take oral contraceptives have a 7-fold risk increase for having a stroke event, and it is the single most common modifiable risk factor in younger women. What about blood pressure? As I mentioned, optimal blood pressure is less than 120/80, and high blood pressure certainly contributes to stroke risk in that it damages the artery walls. It can lead to thickening of the artery and increase the risk of blockage. And high blood pressure can also weaken regions of the artery walls, increasing the risk of bleeding or hemorrhagic stroke. It is important to recognize that high blood pressure should be diagnosed. It's also called hypertension, and a large proportion of individuals in the United States, at least 1/3 of the population, has high blood pressure. 40 to 90% of all stroke patients have high blood pressure before their stroke event. What do we know about cholesterol? Well, there are two kinds of cholesterol. One is known as the good and the other is known as the bad. The good cholesterol is known as HDL. The bad cholesterol is known as LDL. And together these two forms of cholesterol make up what is known as the total serum cholesterol. Total blood cholesterol levels should be between 160 and 200 in order to be desirable. And the healthy cholesterol, or HDL, should be 40 or above, with a lousy cholesterol, if optimal, being less than 100. Unfortunately, most of the cholesterol in our body is made up of LDL cholesterol. And rather than being, if we have too much of it in the body, rather than being taken away through the liver, it builds up in our artery walls and can harden and turn to what is known as arterial plaque, leading to stenosis and atherosclerosis. This occurs not only in the heart, but also in the brain. So the important thing to recognize is that taking cholesterol medicines, eating a healthy diet, and getting regular exercise are the best way to lower not only total cholesterol, but LDL cholesterol. What about diabetes? Well, diabetes affects cholesterol and triglyceride levels in the blood, can cause damage to artery walls, and certainly increases the risk of not only ischemic stroke, but cardiovascular disease in general. The relative risk of stroke from diabetes is highest in the 5th and 6th decades of life in an individual that has diabetes. And like hypertension, the relative risk of stroke from diabetes is highest for men at earlier ages and highest for women at older ages. People with diabetes may also have a lot of other contributing risk factors. For example, the prevalence of hypertension or high blood pressure is 40% higher in the diabetic population compared to the general population. So let's talk for a moment about the risk factor that is not only different for heart disease, but is very important in terms of stroke prevention. And that is treating atrial fibrillation. After hypertension, the second most powerful risk factor for stroke is atrial fibrillation. Atrial fibrillation is an irregular heartbeat of the left atrium or the left chamber of the heart, in which the heart actually beats, or the left atrium beats, up to 4 times faster than the rest of the heart. This then leads to an irregular flow of blood and the occasional formation of blood clots that can occur in the heart and leave and travel to the brain, most often causing stroke. Atrial fibrillation affects about 2.2 million Americans, and those with atrial fibrillation unfortunately have a 5-fold increased risk for stroke. The condition really occurs in those in the upper age range, and about 1 in 4 individuals who have a stroke over the age of 80, the cause is have atrial fibrillation. So what about another important risk factor that people sometimes don't think about? And that is weight management. Important thing to recognize here is that we have an epidemic of obesity and overweight in this country. And you can use a simple technique to determine if you are overweight by measuring your abdominal waist circumference. For men, if you have a waist circumference greater than 40 inches, you may be at increased risk. And for those in women, if you have a waist circumference greater than 35, you also may have an increased risk of stroke. So obesity is a risk factor for stroke. About 35% of the US population are obese in that their body mass index, or BMI, which is another way of looking at are you overweight or obese. For those individuals who are obese, they have a BMI greater than or equal to 30 kilograms per meter squared. And 68% of all adults over 20 are really overweight. Men and women of all ages and races and ethnic groups in the population are certainly affected in the United States by the epidemic of obesity. So the best defense in terms of preventing stroke is knowing what you can do in terms of our best defenses, and that is eating an appropriate diet, exercising on a regular basis, keeping your stress under control, and certainly not smoking. So let's talk now about stroke warning signs. It is important that if you have any of the following warning signs, that you call 911. And most often when a stroke occurs, these signs will occur 2 and 3 together. The signs of a stroke include sudden difficulty talking or understanding words, a sudden loss of feeling or strange sensations normally on one side of the body, sudden weakness on one side of the face, arm, or leg, a severe unexplained headache. Severe unexplained headache is the most common sign of a hemorrhagic stroke. Sudden decreased or blurred vision, and sudden unexplained dizziness or loss of balance. An easy way to remember the symptoms of a stroke is by remembering SOS. And that is asking somebody to speak, to repeat a simple sentence, and to determine if that patient can repeat the sentence correctly. Second, O is to make a big O with both arms and to ask that person to raise both arms. Does one arm drift downward? If so, this may be a sign of a stroke. And thirdly, to ask a patient to smile. And you're looking for facial droop. If one side of a face droops, it is likely a sign of a stroke. So let's think about a quiz. If you're having a stroke, is it better to A, go to sleep and see if it is better in the morning, B, call 911, C, call your doctor, D, get a relative or friend to drive you to the hospital, or E, take an aspirin? The most important thing you can do is certainly number B, call 911. Remember that treatment can occur if the symptoms have occurred within 3 hours of onset in terms of getting to an emergency room. So rapid recognition of warning signs is critical, calling 911 is critical, and getting into the emergency medical treatment by a stroke team is critically important as you enter the medical emergency system. Now, another easy way to look at and to remember the symptoms of stroke is by remembering the acronym FAST. Face, arm, speech, and time. F stands for looking at an uneven smile. Arm stands for checking to determine if one arm is weak. Speech is listening for slurred speech. And time is acting right away in terms of getting a medical emergency treatment. So what can you do as an individual to help others to spread the word? And the most important thing is to spread the word about stroke. We would advocate that you tell 5 people what you have learned today and share on social media the importance of stroke prevention and managing risk factors. You can also order fast cards to distribute at your workplace, and they're available certainly through the Pacific Stroke Association. I want to thank you for participating and listening to this particular educational series, which was made possible by the financial support from our individual donors, foundations, and corporations. Thank you for taking time to learn more about stroke and for spreading the word to your colleagues and friends and family.